So our research was looking at patients that are developing severe dengue, or also what we call dengue hemorrhagic fever. And the main discovery of our research was to identify some cells in the blood of these patients that will help us to distinguish which patients are at risk of developing severe dengue. So dengue is an infectious disease. It is transmitted to humans by mosquitoes. And around a week after somebody is bitten by one of these mosquitoes, you might start to develop some of the clinical symptoms. So the most common symptoms are a very high fever, headaches, backache, nausea, and vomiting. It feels pretty much like a flu type of illness. But a proportion of these patients will progress to develop a much more severe complication of the disease. That is what we call dengue hemorrhagic fever. Now, this leads to much more serious complications like bleeding disorders. And is manifested like bruising in the skin, or hemorrhagics in the skin as well, bleeding from the nose or gums, and even bleeding from internal organs. And if it's not attended, this could lead to very sudden changes in the blood pressure, and leading to respiratory distress, and even multi-organ failure and death.
Yep.
And the issue is that when somebody comes to hospital with a dengue infection, it's virtually impossible for doctors to tell if somebody is going to have mild dengue or is going to progress to develop dengue hemorrhagic fever. And virtually what we found, our discovery, was a population of cells in the blood that is very elevated during the very first days of fever in people that are going to develop severe dengue. So we are hoping that it's going to help us and diagnostic.
Yeah, and that is so exciting. I mean, for people to understand, it's a bit like when people got COVID, trying to identify when it was going to become a very serious, life-threatening illness for them, or whether they were going to recover quite quickly. So I guess the next step is to find this biomarker. How far off could that be?
Well, that will take us probably a few years from now. So we are very excited that we found these cells in the blood. And now what we want to do is to zoom in and try to understand these cells in more detail, deconstruct the cells, if you wish, and hopefully we identify a specific, highly specific molecule or biomarker. And then we will have to validate this biomarker in other geographic locations where dengue fever is endemic, that is in countries in Southeast Asia and in South America, which might take us a couple of years. And then after that, we will move into the production phase of making a diagnostic kit that, similar to what you mentioned, to the rats that we use for COVID, that hopefully doctors can have at point of care to treat patients.
Yeah. You were working in Indonesia. Could different countries differ from others?
Yes, I mean, it's very important in Southeast Asia. You have to think that this is transmitted by mosquitoes. So dengue is very big in tropical and subtropical regions. But like 70% of the cases of dengue that we have in the world happen in Southeast Asia. And Indonesia is one of the most affected countries, but it's all spread out in the region and also in South America.
Yeah. So what sort of game changer could this be for public health in many of these still developing countries?
Well, that's actually a really important point. As I said, I mean, it's very difficult to make decisions on which people need to be admitted to hospital and which people can go and manage from home. And we know that the cost of hospitalized dengue case is roughly 3 times higher than the case that is managing from home. So having a tool for doctors to help them make these decisions is definitely going to make a substantial economic impact in these countries, in these endemic countries that have so many cases.
Yes. So if you see that marker, is there a home treatment you can give to people to manage it, to stop its progression?
There is no treatment for dengue thus far, and that's why it's so important to know as early as we can if somebody needs to be admitted to hospital. It's basically keeping the person hydrated, and maybe you need to go into a drip to keep the fluids up. And if we know that this person is at risk of developing this disease, can be using that bed and receiving that care that is so crucial, because there is no cure or treatment, antiviral treatment to kill the virus.
Yeah, well, really exciting development. Congratulations and good luck with the next phase.
Thank you very much, and thanks for having me.